video module, we will review care measures to help prevent complications in adult tracheostomy patients. The tracheotomy procedure itself requires a surgically created opening in the neck. The tracheostomy opening is created below the larynx and vocal cords. Epinephrine is injected to decrease bleeding during the procedure. After proper dissection, the tracheostomy tube is placed in the airway. Stay sutures are typically used to secure the stoma and to allow for emergency access during the immediate postoperative period. Some facilities or physicians may opt to perform a similar percutaneous or bedside procedure for placement of a tracheostomy tube. In the United States, a dual cannula cuffed tube is considered the primary surgical tube. As with any surgical procedure, there may be complications related to the procedure itself or to the patient's underlying disease. It is a clinical priority to understand and prevent early and late complications. Early complications include accidental decannulation, obstruction by mucus plugs or blood clots, hemorrhage, frank hemorrhage from bleeders post-surgery, post-obstructive pulmonary edema, pneumothorax, creation of a false passage, and damage to the vocal cords or vocal folds. To minimize equipment complications, manufacturers recommend pre-inspection and testing of the tracheostomy tube to ensure proper functioning prior to procedure. Later complications include obstruction by mucus plugs, accidental decannulation, wound infections, hemorrhage, tracheal malacia, and formation of granulation tissue at the incision site and at the cuff site. Managing cuff pressures of the tracheostomy tube is critical. Too much pressure may lead to tracheal damage from contact with the cuff material. Too little pressure, and you may not provide proper ventilatory support. You should measure cuff pressures with a manometer and chart both pressure and volume of the air placed in the cuff. Low pressure cuffs may prevent injury to the tracheal mucosa. Serial increases in cuff pressure measurements and volume may indicate airway dilation. Even short-term incidents of high pressure may lead to tracheal damage. General recommendations suggest that cuff pressure should be maintained between 24 and 30 centimeters of water. Proactive tracheostomy care can reduce the risk and occurrence of postoperative complications and promote positive patient outcomes. Coordinated discharge planning and home care teaching will help to successfully transition the patient from hospital to home. Nurses and respiratory therapists can play a crucial role in developing evidence-based practice standards and protocols for the care of the patient with a tracheostomy. Working within your facility to establish these standards and practices can help you to deliver excellence in tracheostomy care. Ultimately, as with many medical procedures, diligent tracheostomy care can prevent complications and improve patient safety. Remember, confidence and competence equals improved care. For additional information about all of our tracheostomy products, please visit our website at medtronic.com.